Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday, the 10th of March 2021. And I think it's an improving picture, I'm happy to say. Today, when I look at the data, we've got 24 COVID positive patients in the hospital who are within 14 days of their first positive swab. This time last week it was 36. Remember, if we go back to the middle of January, we were talking about 150 and sometimes a bit more than that. If we take patients who are in hospital because of COVID but are now beyond 14 days, there's an extra 53, so that takes us up to a total of 77 patients. And as far as our critical care unit's concerned, we've got 7 patients in ITU, intensive care, who are there because of COVID. And if you remember, in the very height of the pandemic, we had 32 critical care beds open, where our normal number is 16. I'm happy to say we've got down to 20 now, and with a bit of luck can get down to 16 at the end of the week or next week. And that will really be a moment when we get back into something like business as usual as far as all of the elective activity is concerned, all of our ordinary operating and of course our cardiac, cardiothoracic surgery and so on. I'm reporting today that we've had 3 COVID deaths in the last week. Every one of those is a great sadness to us. It takes our total to 749 for the whole of the pandemic. But again, I'd remind everyone that in January and perhaps December, November, October, we'd often be talking about 25 deaths per week. So we're seeing a real reduction in those, and that's great news. And when I look at the number of COVID positive patients in the hospital, and I've talked before about the major risk factor being age, it's great to see that there's a very small number of patients now who are over the age of 85 who are with us. I think the number is 3, and I think that really demonstrates the impact of the immunisation programme. It's been so successful, and thank you to everyone who's both delivering the immunisations, and thanks for everyone who's having them, because it's making an enormous collective change to the risk profile. In the hospital, we've done over 18,500 vaccinations now, and we are working through second vaccinations. So if we did your first one and you are expecting your second one, please just wait, because we're working through the list and we'll get to you just as soon as we can. I think when we finish that whole round of second vaccinations, we may well begin to step down our programme, because the community centres, including the winter gardens, have got great capacity and are really working through at a superb rate. So we'll pick that up as time goes by. So I think if we look at community data, we're seeing progressive improvement there too. Today the figures show Blackpool at 77 positives per 100,000. This time last week it was 80. The Fylde is showing 82 per 100,000. This time last week it was 114, and Wyre has really come down to 37. This time last week it was 75. I don't really think we've seen those numbers since last September, and the great news again in that data is that the number of people who are over the age of 60 who are testing positive is really coming down sharply. And since age is an important independent risk factor for COVID, this is such an important piece of news in terms of people being really poorly. So I suppose the big thing that's happened this week is that schools have gone back, so we will be seeing a lot more interaction of particular groups of people, and of course are watching rather cautiously and carefully about the impact in terms of numbers. It will be too soon to say this week. We'll need to monitor it over the next few weeks for sure. But it really reiterates the importance of the usual messages about being very careful about social distancing, for example at school gates, making sure we wash our hands thoroughly and regularly, and wearing face coverings when we're out and about, and as appropriate. So thanks again for your input in this, for the collective efforts to help reduce risk. I think we're going in the right direction. We just need to keep going. Thank you.